don't do anything to take care of my eyes, but as I've heard, checkups are very good for taking care of your eyes, eating carrots, and eye drops as well that can take care of cleaning your eyes.
We eat carrots, we pour out eye drops, we wear shades, that has SUV protection.
If like the wind is blowing, you don't have to go outside. You have to stay one place so that the wind will not enter inside your eyes. It's very, very important. You understand what I mean? So anywhere you see they are fighting, you must be careful so that they are not going to wound you.
Are you seeing a change in your eye color? Dry eyes with itching and burning, excessive discharge or tearing, or episodes of cloudy vision? Well, this could mean that you've got something seriously wrong with your eyes. Hello and welcome. I'm your host, Dr Martin, and signing with us today is Trifosa Nzwelengwe. On Vital Signs, we focus on eye health. Eye Care Awareness Month is commemorated on the 20th of September to the 17th of October to raise awareness about the importance of eye health, specifically around the prevention and treatment of avoidable blindness. Now, 75% of blindness is actually avoidable either through prevention or through treatments, which is why it's so important to get your eyes tested at least once a year. Now, coming up on the program, we'll listen to an insert produced by Zama Buthelezi. She spoke to an optometrist about the importance of eye health and the consequences of the lack of access to eye care. We'll also speak to an optometrist who is the president of South African Optometric Association about eye health and the importance of taking care of your eyes. We then continue this discussion with the president of the South African Optometric Association and practicing optometrists about the organization's objectives and the main aims for the 2021 campaign. Zama Buthelezi will update us on the latest COVID-19 numbers, and Dr Martin McKay will be there to answer all of your COVID-19 questions. Remember that you can be a part of the show by asking our guests some of the questions that you have on your mind by simply sharing all of those with us. The number to call is 011-714-5861 or 011-714-5877. You can also share your thoughts with us on social media by using Twitter, that's at SABC Vital Signs, or Facebook, SABC Vital Signs. Vital Signs will continue right after this ad break. Welcome back. This is Vital Signs. I'm Dr Martin, and Eye Care Awareness Month is commemorated on the 21st of September to the 18th of October this year, with World Sight Day falling on the 14th of October 2021. Now, this month is underpinned by the theme Love Your Eyes, which takes into consideration the challenges encountered around the world as a result of the COVID-19 pandemic, aggravated by many thousands of South Africans who are needlessly visually compromised because of a lack of access to appropriate care for their eyes. Now, let's listen to an interview that Zama Buthelezi took, and she spoke to optometrist Audience Maluleke.
Audience Maluleke, practicing optometrist from Gauteng in Randburg, explains to us the significance of commemorating Eye Care Month.
Statistics show that almost each and every one of us is going to have one or other eye health related issue. And if you go back to the statistics as I refer to now, almost 1 billion people do not have access to eye health. So Eye Care Awareness Month, it's exactly for that, to actually bring the messaging to the people that it is important to actually have eye health checked.
Talk to us about the eye illness symptoms that should make us alarmed and seek help immediately.
People should start having eye examination and eye screenings as soon as they're born. Actually, it is standard that pediatricians, when a child is born, they actually do check whether there is a vision problem on a child, and because they can be able to put up interventions that can be life-saving, to be quite honest. As well, at preschool age, that is where children are going to be learning pictures, words, and all sorts of things. So when they are when they are screened for those eye health conditions, we can be able to find out if there is intervention that can be made at an early age, because at that age they are still in their formative years. So things such as squint eyes can then be arrested at that time. We can be able to correct them.
What are the most common conditions that Maluleke sees in his practice daily?
We see too much of myopia, which is short-sightedness, and with myopia, it has now been said that almost half of the population would be myopic by the year 2050. And that is necessarily because of lifestyle. I spoke about lifestyle earlier with respect to children, that nowadays we're actually having more of visual display gadgets, cell phones. We're doing a lot of stuff. Actually, children are actually too much on their gadgets. They are too much up close. So the myopia concept, it is starting to be some sort of an epidemic. We see as well astigmatism, which to a large degree we say it's when the shape of the eye is not fully spherical, it's not fully round, it's actually ovalish, like the rugby ball, where the points of focus are not are multiple point focus and are not focusing on one area, and that can be due to the fact that the children may be having some other allergies, environmental allergies, and then they'll be rubbing their eyes, and by doing that they're actually altering the shape of their cornea, which leads to astigmatism. But although astigmatism does not only come from that action, can come from just being yourself. We have presbyopia, which is also an age-related condition that affects people that are just over the age of 40. When they said life begins at 40, they didn't mean that you're going to be a billionaire. They meant that certain conditions will start to manifest themselves. There are other conditions that we see that are a result of injuries, but others that are a result of lifestyle or other chronic illnesses that we suffer from as society, such as diabetes, diabetic retinopathy,
Talk to us about the eye illness symptoms that should make us alarmed and seek help immediately.
When you feel that your eyes are blurry, when you look at something and it looks blurry, that's one of the first flag that you must be in the lookout for, especially with children. When they are sitting in class and the child is unable to see properly what is written on the board, and the teachers must be in the lookout for that. They should necessarily start to say the child needs to have some other intervention. Itchy eyes, teary eyes, when you have headaches, when you actually engage in reading and computer work, it's also one of the symptoms that we need to be in the lookout for. And especially with computers, there is a computer vision syndrome that we would want to warn our communities of. And we recommend, that there must be a 20-20 rule, which means that after working 20 minutes in a computer, take your eyes away from your computer for 20 seconds and look at something that is 20 feet away. And 20 feet, it's about 6 meters.
What is the impact of missing out on follow-ups because of fear of contracting COVID?
In one way, devastation. For an example, you were being monitored for a condition like maybe glaucoma, which is characterized by a rising pressure within the eye, and you miss out on going for that your follow-up, the damage continues to happen while you are sitting there at home. So the damage cannot be reversed.
After the break, we speak to Dollars Boloka about eye care and, of course, how you can recognize all the signs that come with it. See you after the break. Welcome back. This is Vital Signs. National Eye Health Week has begun with a focus on raising awareness of the importance of having regular eye tests. Running from the 20th to the 26th of September, the campaign will draw attention to symptoms of poor eye health and encourage good habits, supported by a range of activities as well as resources. Now, themes for each day range from children's eye health to screening, as well as the use of vision and other things that involve driving. Now, nearly everyone on the planet will experience some sort of eye health issue in their lifetime, with more than 1 billion people worldwide without having access to eye care services. Now, the South African Optometry Association, in collaboration with our local and international partners, intends to deliver the biggest and most ambitious Eye Care Awareness Month campaign yet by encouraging everyone to take care of their own eye health. Now, President of the SAOA, also a practicing optometrist, Dollars Boloka, educates us about the importance of eye health. Good day. How are you?
Good day, Doctor. Thank you very much for having us. I am very well, and I hope you and everyone in the studio are well. And greetings to the viewers at home.
Great stuff. So let's talk about eye health. It's, you know, a part of just general health that a lot of people don't necessarily pay attention to because it's a forgettable one. The only time that you mention or see something has happened, it's when, you know, you abruptly can't see it. But these gradual things are often chronic. So tell us about eye health and why it's so important.
You're correct, Doctor, to say that it's something that most of us, we take for granted. And perhaps also because that we have two eyes. In other instances where you find that it's only one eye that has a problem, it becomes difficult to pick up that there may be other underlying issues. But as even with the World Health Organization, the taking for granted of vision, it's something that is common everywhere. And that is why we are, even on your show, and every year there's this annual Eye Care Awareness Month that runs between the month of September and October. And within that, we celebrate what we refer to as the World Sight Day. These campaigns are always intended at making the public aware and conscious about the importance of their eye care. Other people pick this up when they go for traffic screenings that they actually cannot see and are therefore unsafe to be on the roads. Kids at school may not necessarily see as good as their colleagues seated at the same distance. And it's things that, unfortunately, with the issue of vision, it's only when you get tested that you get to understand that there's actually a better aspect of seeing. When you are born with a certain vision. And most often than not, that vision that you have, it is the only vision that you know. And until the day that you are fully examined, you may never know that there's another aspect of view of how the world can be seen. So unfortunately, it continues that we do take our vision granted. But as the SOA, we are here to try and encourage everyone that it's very important to look after our eyes, to love our eyes, and to have them examined so that if there are problems, they are able to be picked up and we can be assisted in the proper way.
Okay, so let's talk about vision versus eye health. What is the difference between the two?
All right. We as a profession, we talk about vision and eye health examination, and that is because the most common aspect is the vision aspect, where people, my colleague, Audience Maleke, was speaking about glare and all that. It's what is quite very common that people will experience glare here and there, or will actually just have a glare. People will struggle to read. You will see the older members of our population holding things slightly at an extended arm's length to see clearer. So when they cannot see very well, they can clearly know that they've got a vision problem, and automatically that becomes an eye problem. But an eye health problem is a problem that's related to the diseases or pathologies of the eye. An eye, just like any other human part, can have certain diseases, and if they are not looked at or looked after, they then also get to affect the vision. And the person in other instances might lose sight. So the difference is that the diseases are things that are pathologic in nature. They need a different kind of treatment versus the vision problem that mostly we correct via optical devices, be it spectacle lenses, low vision devices, contact lenses.
Okay, so what are the common problems that a patient that comes to see you complains about when they complain of having vision or eye problems?
With vision problem, as we've said, it could be an issue of glare. Somebody will struggle to see nice in the classroom. Somebody will struggle to drive at night. Somebody will struggle with a lot of computer work. Somebody will tell you that, look, when I'm outside, the sun is too shiny. It's as if the sun intensity has increased over the years. So you get a variety of those, and the common signs is the common ones is the myopia one, which is short-sightedness. There's also the hyperopia, which is far-sightedness, and where people for an example, most of us we are expected to be working from home in front of our laptops. So people who are hyperopic, who are far-sighted, will struggle with doing things that are around their table. We call them near work things. There's also what we call astigmatism, which is just a terrible thing. I call it a mixture of both, that people have got this persistent cloudy vision. And of course, there's also the presbyopic aspect, where it affects those of us that are over the age of 40. The ability to read start to diminish. As audience have said, life begins at 40. So the ability to read on human beings that are normal as in emetrope or normal sighted, the ability to read diminishes as they reach the age of 40. Those that are myopic, are short-sighted, when they remove their specs, I'm sure you note sometimes in restaurant, you'll be surprised an elderly removing their specs and being able to read whatever the menu that they've been provided. It is because that their myopia is now making up for the presbyopic condition that they're supposed to be in. But a normal anomaly is that a person who's normal-sighted after the age of 40, they will struggle with their reading. So those are the common visual problems that we have. In terms of the eye health, the common ones is mainly your dryness, conjunctivitis, but because of the UV exposure and where we are as a country in terms of the sun, there's also a very high prevalence of cataracts, which is basically the clouding of the lens that unfortunately at a very later age in life, it starts to bless our blinds, our elders. You'll be told by our old grannies that, look, my mom passed on. When they passed on, they were blind. My dad was blind. So when I'm blind, it's expected, it's in the family. But unfortunately, that is just cataracts that we say they're needlessly blind, because a very quick procedure with an ophthalmologist, people's eyesight are instantly restored. We do have glaucoma, we've got age-related macular degeneration, and many other eye diseases. The retinopathies that are linked to the lifestyle disease. So it's quite a lot of eye health diseases that are there, and hence, again, the importance of always making sure that we get our vision and eye health examinations done at least annually.
All right, so let's get into some consultations now. A few callers that have a couple of questions that they'd like to ask. Desiree from Cape Town, from Durban. Good morning. Desiree? Desiree? All right, so whilst we get Desiree back on the line. Hi, yes, there she is. Hello. Desiree. Yes.
Okay, I just got a problem with my eyes is tearing. And it's always tearing. So I just wanted to know what's the cause.
All right, so the eyes are always teary. What is the cause? What might the issue be?
The most common sign of also dryness is excessive tearing. When the eye is very dry, the body, as it does with many other things, when the temperature drops, it overproduces. So unfortunately, the outer part of the eye is not equipped enough to handle as much tears as possible, but it is the eye mechanism of trying to produce enough tears so that it can wet itself. I'll advise Desiree there, and thank you for the call, to visit a nearest optometrist so that the whole tear film layer can be properly examined to check what will be the actual cause of the dryness and which part of the tear film layer is causing that particular dryness, and how best can it be corrected. But it is definitely got to do with the dryness of the eye.
Thank you, Desiree, for that question. A very quick one. With regards to access to optometry services, how do people go about getting in contact? I mean, you walk around in town, you see optometrists, in a corner there, but do people that can't necessarily afford private optometry get access to optometry elsewhere?
Yes. As a country, we have advanced, I think in the past 20 years or so, we have really advanced to introduce optometry services into the public sector, to make sure that those members of our public that are not able to afford the private sector optometrists are able to visit the public sector optometrists and institutions and to be assisted. As it is, I think we just have somewhere around 350 optoms all around the country. We have been in touch with the National Department of Health. They've been, in the past 2 years, they've been conducting an audit of the optometry services that are available in all the provinces, as well as the equipment that are there to make sure that if indeed the optometrist is there, there's also supportive equipment for the optometrists to be able to carry out their duties professionally and ethically. So there is services in the public sector, and as well as we've mentioned, a whole lot more we are there in the public sector.
Okay, so let's talk about lifestyle diseases that exist sometimes as vision problems. How do these two come into contact?
There's an old saying that the eyes are the windows to your soul. The common lifestyle diseases in diabetes and hypertension have got a manifestation of into the eyes, the ocular manifestation thereof, and we refer to them as hypertensive retinopathy and diabetic retinopathy. Both of them, when they manifest in the eye, the small micro blood supply, the blood vessel that goes at the back of the eye on your retina, they become somehow porous, and they start to form small blood clots around your retina and around your macula, which is the back pole, the posterior pole of the eye. And it is quite very important that the integrity of the retina remains as clean as possible, because that is where images are formed, and that is where we actually, our vision is interpreted as it goes back to the brain. So when these blood vessels get affected in that manner, they then in turn start to affect the vision. So most people who might have these lifestyle diseases and then are not aware, firstly, that they have got these lifestyle diseases, as the optometrist does his own the optometric examination, one of the tests that is done is to check the posterior pole, the integrity thereof. And if it is picked up thereof that those things are there are then a multidisciplinary team, including doctors and other specialists, to make sure that the ophthalmologists, to make sure that they are corrected, but importantly, that the person is very aware that indeed they have got these lifestyle diseases. There's also what you call a refractive status alteration, meaning that, for an example, a person can be short-sighted and not aware that they are diabetic. And when the sugar level then spikes higher, it changes the refractive status of the eye. And in changing that, in short-sighted people, sometimes it makes them to see better, where people will think that there is a miracle. They've recovered immediately from the poor vision that they've been having over the years. And as a matter of fact, I have a colleague that recently were discussing a story where a patient called him that I'll be driving out of the province, and I'm surprised when I wear my specs, I can no longer see, but when I take them off, I can see. The colleague advised the patient to try and see the GP as soon as possible to check either hypertension or diabetes, but unfortunately the patient was not able to do that, and then he advised them to live with their spectacles. Over the weekend, the patient was properly seeing the best vision that they've had in a long time. And as they came back, the sugar level was stabilized, and unfortunately, they went back to their myopic condition. This also happens with hypertension. So there's a change in, firstly, at the back part of the eye, but also there are changes within the refractive status of the eye that then affects how a person sees. So it's quite very important that those that have got lifestyle diseases get regular checkups, firstly to check the posterior pole, but also these silent signs of visual changes. It's very important that they're always looked at.
All right, we've got one more caller for you who's got a consult that they'd like to have. Zach?
Yes.
We're listening. What's your question?
Yeah, I'm just watching the TV now. Even if I can't see clearly, but I heard you talking about the eye problem. My eyes it's blurry. I can't see pictures. I cannot even see like the telephone. But the only thing I was attending at Dr. McKay, but now it's closed. Yeah. The main problem, when I wake up early in the morning, I can see, but after an hour or 30 minutes, my eyes becoming glary.
Okay, thank you, Zach.
I believe I've got the problem. One of my eyes has got a glaucoma.
Glaucoma. All right. I think we've got your question, Zach. We don't have a lot of time, but I'll let Mr. Buloka answer that question for us. A problem of having deteriorating eyesight throughout the day. How do we solve this very quickly?
No, thank you, Zach, for the question. I would advise just from the short thing that Zach has spoken on, maybe he has said the place that he used to visit is closed. If he can just call the SO office, we'll try to locate the nearest assistance for him. Also, the fact that there's glaucoma present there, I think it's quite very important that he is thoroughly checked. So if he can just call the SOA office, we'll advise where closest can he be assisted.
There we go. There's your answer very quickly. But of course, we're going to continue this conversation a bit later on. Screen time and children using laptops, iPads and things such as that. How has this affected vision in young children?
We are heading for very worrying times as a globe, as a world, as a nation. My colleague Malwege spoke about the studies and projections that by 2050, half of the world will be short-sighted. And that was done prior to COVID. Since the introduction of COVID, most of our colleagues now, what we see in our practices is quite a very increased progression of myopia and an early onset thereof, because kids are now doing online studies, but also the increased device exposure. So this is something that while the technological advancement of the world has to progress, but unfortunately for the vision and the visual system, it's something that is going to have a negative effect. It's going to increase the prevalence of short-sightedness and therefore increase those that cannot see very well and hamper the ability to learn very well without the assistance of optical devices or interventions surgically thereof. So the continued exposure of these devices, it's a big concern for us, but it's something that I think the whole world is looking at, finding interventions and innovations to try and check how best we can assist and limit the progression thereof. The exposure to the emissions of blue light that is also exhibited by these devices is something that is concerning. There's always an advice that we give to our patients that, especially for kids, and even the elders, they must avoid using phones, computers, and laptops at least an hour before they sleep, so that they can have literally a peaceful night rest. Their sleep patterns will not be disrupted thereof. So the exposure has got many connotations, and then unfortunately, most of them with regards to the vision and eyesight and the visual system, most of them are not necessarily positive.
Okay, look, we'll continue this discussion and speak about what's happening with regards to the campaign and what we need to look forward to. And this, of course, is Dolas Buloka, who's the president of the South African Optometric Association, as well as a practicing optometrist. This is Vital Signs. We'll see you after the break. This is Vital Signs. It's never too late to start taking care of your eyes. Whether your vision is suffering steadily or you've been faced with eye problems all your life. Well, actually, all of a sudden, the South African Optometric Association has planned to raise awareness for avoidable blindness and the importance of regular eye examinations throughout the month. To this end, the SAOA members have encouraged, or are encouraged rather, to make a difference and provide Love Your Eyes in their practices to those in need, particularly on World Sight Day. We continue our discussion with Dolas. Max Boloka, who is going to answer a few more questions, doing a little consultation here before we get into the campaign objectives for this month. I've got a caller. Good morning. Okay. Hello? All right. Dora seems to be off. Is Jade on the line? Jade? Hello, Jade. All right, no issue. So let's continue with the month of October firmly here. And of course, you know, vision being what you guys do. Let's chat about the campaign that you've got running.
No, thank you. We have joined hands with the IAPB and the World Council of Optometry in pledging to do our part as South Africa to contribute to the 1 million eye vision and eye health examination during the Eye Care Awareness Month as of the 21st of September and up until the 18th of October, of course, embracing the theme Love Your Eyes. So South Africa and the SOA, we have encouraged all our members to do their part. And also because of the COVID pandemic that we were not able to have many people gathering in one areas, to do their best in their own communities and offer the services to the members of the communities that may need them. And we have also released 9 posters that educate the public about the importance of vision and eye care, as well as spreading the Love Your Eyes message. It is also there on our Facebook page and the Instagram page. Viewers can search for the South African Optometric Association or my SAOA to have a look at those posters.
So what objectives are you trying to reach with this campaign? What's the main aim? What are the things that you're chasing over the next month?
The greatest win for us is to have as much as an increased awareness as possible, because as we say, this is an Eye Care Awareness Month, is to drive awareness to the members of the public about the importance of vision and eye health, and hence the drive to contribute immensely, particularly the country of South Africa, to the 1 million vision and eye health examinations. We do hope that we can have a small percentage contributed into that, noting that even the developed nations have pledged to contribute into the same pledge throughout the world.
So we can't ignore COVID and what it has done over the past 2 years with regards to allowing people access to these services. So how are we making sure that the people on the ground are aware of the month that you currently have running?
You know, just yesterday, as we were preparing for this interview, engaging with our CEO, he mentioned something that in 2019, all across the 4 provinces, the Free State, KwaZulu-Natal, Limpopo, and Gauteng, because that is where we have got the optometry training institutions. We have had just over 1,000 people screened, examined, and others dispensed with optical devices in the year 2019. And unfortunately, since the inception of COVID, we are no longer able to have those kind of drives, and it has really affected the way the association does these processes of Eye Care Awareness Month. So, but as it is what it is, and we have to adapt. And as part of our adaptation is that we are then encouraging members in their own practices to do as much as they can, and also those in the university institutions, if possible, to try and push these drives to make sure that the majority members of our populations are assisted from their visual and eye care needs.
Great stuff. I hope the campaign is successful. But let's go back to some consultations. Dora is on the line. She has a question that she'd like to ask you. Dora?
I'm here.
Yes, we're listening. What's your question?
My question is, what might be the problem with my eye? When I'm outside, I see a dark spot with one of my eyes. And that occurred, I think, last year in November. And the dark spots are still there when I look with my eye when I'm outside the house.
Are they still there, or do they come and go?
Come again?
Are they there the whole time, or do they come and go?
Yes. They are there the whole time when I'm outside.
All right, they're the whole time, dark spots whenever she's outside.
Thank you, Dora. And she says they are permanently there, but she only notices them outside. It might be an issue that has to do with the field, but as well, just recently we had a case, a colleague of mine saw somebody who had what we call a pituitary adenoma, which is just a tumor that grows just next to the pituitary and starts to press on it. That also forms a little bit of dark and blurrish visions in one portion of, in one eye and in one portion of that eye. Again, I would advise Dora to have that checked and importantly to make sure that when she does present herself to the optometrist, she makes it very clear that this is there so that it can be clearly investigated into, and if needs be, a referral will be done, or there will be other interventions that optometrists can assist with.
All right. I hope you get sorted out, Dora. Make sure that you go get a consultation so that that can get sorted out ASAP. We've got a tweet here. This one from Deco saying that, good morning. I have a problem with red eyes. I don't smoke, I don't drink, and I have used a lot of eye drops, but I still don't see a change. What might be the problem? Tell us.
So Deco says those who drink and smoke are fine to have red eyes. Because she does not. No. We call it hyperemia. Normally, there will be irritants, those that have got a lot of allergies, those that rub their eyes a lot, will always present with redness. And if it's very common, it means that whatever that is irritating, because the redness is an after effect. It's something that happens because the eye is trying to get rid of something. So it calls on the blood vessels that lie underneath it to come in and fight whatever that might be irritating the eye. So again, importantly, because redness or hyperemia, it's one of the common signs that we do see an eye that is diseased or that has got pathologies also present with redness, an eye that has got what we call uveitis or even glaucoma. It presents itself with the red color. So when an eye is persistently red, it's something that can be very worrying, and it's always better to be safe. In this instance, have it comprehensively checked out, the internal aspect, both the anterior chamber and the posterior chamber, which is basically the outer part of the eye, the inner closest part, and the inner deeper part of the eye. They will need to be checked properly so that we can eliminate any other issue that might eventually even be threatening to DECO.
Well, thank you for that one there. That was Dolas Buloga, President of the South African Optometric Association and practicing optometrist. After the break, Zama Buthelezi will take us through the latest South African COVID-19 numbers, and we'll speak to Dr Martin McKay as he answers some COVID-19 questions. See you after this.
To Vital Signs viewers, I'm Zama Buthelezi. Nationally, we have exited the third wave according to the current definition. The national 7-day moving average of daily case numbers, positivity rate and testing rate continues to decrease, with sustained decreases seen in all provinces. While all this is great news, remember that receiving a COVID-19 vaccine is a safe way to build protection against the disease. COVID-19 can have serious life-threatening complications, and there is no way to know how the disease will affect you. COVID-19 vaccination can help protect you by teaching your body to fight the virus without having to experience sickness or putting yourself at risk of severe illness. For now, though, let's take a look at the national COVID-19 statistics. To date, 17,828,983 tests have been processed in the country. Positive cases, we're approaching the 3 million mark at 2,907,619. People who have recovered 2,783,018. Active cases, we seeing a decline at 36,679, but sadly 87,922 people have died from COVID-related complications, and we're sending our sincere condolences to their families. In the last 24 hours, the country has recorded 768 new cases. So what's happening in the provinces? Looking at the provincial breakdown of new cases, the total number of cases today is higher than yesterday and lower than the average number of new cases per day over the last preceding days. Just wondering if the long weekend that we just came from is to blame for this, but the 7-day moving average daily numbers of cases has decreased. Gauteng remains the epicenter of the third wave of the pandemic, with a huge drop in new daily infections compared to KwaZulu-Natal and the Western Cape provinces, where majority of new cases lately come from. And also there has been an increase in hospital admissions. For now though, let's take a look at the infection numbers recorded in the provinces with big metros. KwaZulu-Natal has recorded 193 cases in the last 24 hours, followed by Western Cape with 151 cases, Gauteng 127, and the Eastern Cape with 65 new cases just in the last 24 hours. While the infection rate is finally showing clear signs of declining, Mpumalanga and the Northern Cape are showing fewer numbers of people taking the COVID jab. Hopefully more people can have some courage to go and receive vaccination. Otherwise, we risk going through more of the same harrowing COVID tragedy in the future. Remember, the only way to avoid another peak is for everyone to be vaccinated. For now, though, let's take a look at the numbers recorded in the remaining provinces. Free State in the last 24 hours has recorded 60 cases, followed by Northwest with 53, Mpumalanga at 51, Northern Cape at 48, Limpopo at 20. Vaccine registration and inoculation is still open for those ages 18 and over 18,000 people have been vaccinated to date, according to the NICD. We are all still urged to register and go out there in numbers to vaccinate to lower COVID severity and hospitalizations. Let us continue to take precautionary measures, and these include regularly washing our hands with soap and water, sanitize using sanitizers containing 70% alcohol content, wear a cloth mask that covers both our nose and mouth, practice social distancing, and ensure proper ventilation indoors. Lastly, avoid mass gatherings. If you believe there is a chance you may be infected with the virus, call ahead to seek medical help from your healthcare provider or use the public hotline. It's a toll-free number 0800-029-999 and alert them to your symptoms. Remember to protect yourself, protect others. Back to you, Musa.
Thank you so much for that one. I think it's important that we, keep working and keep working it and keep working it up until we get to a point where those numbers no longer mean anything. And of course, as we start to prepare for the fourth wave. But we're having the chats that we normally have towards the end of the show with Dr. Martin McKay, and he's going to answer some of the questions that have been bothering you, making you go, how but doctor? Dr. Martin McKay.
Morning, Doc. Thanks for having me again.
Good. Let's chat about a little something. Very recently, we've heard news that stadiums will start to be open for those that are vaccinated. And of course, those that are unvaccinated won't be able to access those facilities up until a point that they do so, up until we reach herd immunity. Why is it important that people that are vaccinated, or why is it important that people vaccinate in that regard? What is the importance of vaccination?
Yeah, so the moment you have gatherings, there's a high risk of spread. We know that, especially with the Delta variant, showed that one person could potentially infect, the RR number, one person could potentially infect between 5 and 8 people. So if you are in a stadium environment and some of the people who are attending a soccer match or whatever match it could be are infected, you can imagine in no time that particular event could start or become a super spreader event, where from there, all those people who are exposed to the infected person take the virus home, and then it's into homes, into communities, into suburbs. And what do we have? Another wave. So it's absolutely vital that whenever there is a gathering of any nature, be it a sports event, be it a church environment, funeral. Ideally, everyone who attends those particular events must be fully vaccinated. That's 2 doses of Pfizer and at least 1 dose of J&J.
I think the argument a lot of people come up with there is then, but COVID people that have been vaccinated can still get COVID. So what is the point if everyone is in the stadium and everyone is vaccinated, but they can still get COVID? Then why aren't we allowing everyone in?
So it's all about risk. If everyone's vaccinated, yes, there's still a potential, but that risk is much, much lower compared to if people were unvaccinated. Also, if there's a lower risk, there's a lower risk of getting COVID. There's a lower risk of passing it on because your viral loads are lower. And if you do get COVID in that particular instance, your risk of getting severe infection, getting hospitalized or dying from COVID is virtually reduced almost to zero. And so it's almost as if you're saying, well, if I get COVID, it's okay because I'm vaccinated. I don't have to fear dying from it. There's a lower risk of me passing it on. And so just because I can get COVID is not a reason not to get vaccinated. It's very important. It's all about reducing the risk of severe illness and reducing the risk of passing it on so that you don't have a super spreader event.
Chatting symptoms now. One here from Monopi saying that, hello, please help. Can I take the vaccine while I still have discomfort in my chest? It happens mostly after eating, and I went to the doc, but it's still coming back. I think we've had a similar question to this one in the past. What's the answer here, doc?
The answer is it's most likely acid reflux. It has nothing to do with any respiratory illness, so it's perfectly okay to get the vaccine. Remember, the principle is this. You don't want to be acutely ill with some sort of viral infection, like having a bad cold, a flu, what could potentially even be COVID. Any other symptom, especially if you've had COVID in the past, is perfectly okay to get the vaccine.
Another question from Terry saying that, has anyone with a long COVID improved when they've had the vaccine?
Yeah, so that's a very good point. The data doesn't seem to suggest the vaccine has a therapeutic effect on long COVID. What we do know is that if you do get COVID, having been vaccinated already, there's a much lower risk of you getting long COVID. But long COVID, it seems, it usually gets better with time. But don't expect the vaccine to have an effect on your long COVID.
Hello, Doc. Just reconnecting there with Dr. Martin McKay, answering all the COVID questions that you may have in your mind. There's one on the screen right now, and as soon as we get the doctor back, I will, forward that message to him. It says, hi, my 7-year-old started with symptoms yesterday, low fever, runny nose, and fatigue, and also has ADHD. And now all he wants to do is sleep. Took him to the doctor yesterday, and she said that it's an upper respiratory tract infection. This morning, he has a fever of 38 degrees, which I gave him medication for, and he's coughing with a runny nose and still has a general feeling of unwellness. Doctor said that we should wait till tomorrow, Saturday, before I bring him for a COVID test. So, Doc, welcome back. We're chatting about COVID in children. A child that has basically been seen by a doctor, told that they've got an upper respiratory tract infection, but has gotten worse over that time, and that there's a delay in COVID testing. What is our protocol, or what do we do with regards to children and COVID testing?
Yeah, I think it's really important that we test. Generally, right at this point in time, we know that the numbers are down. So the chance of having COVID is much, much lower than, for instance, a few weeks ago. And the doctor should have the clinical acumen to determine if this is just a plain upper respiratory tract infection, allergy-related, whatever the case is. But I think it's a good point that if there is no improvement, and this is in the guidelines as well, if you suspect that it's a plain upper respiratory tract infection, you treat it as such, and there is some sort of deterioration or an extension of the symptom, in other words, they're not going away when they should have, it is perfectly acceptable and I think very, very suggested that one does a COVID test. It's important, especially in the context of spreading. You want to limit that spread, limit the infection, make sure there's isolation, and I think it's a very good idea and important that one does a COVID test.
Let's chat about, very quickly, about children and COVID. What are some of the signs that we need to look out for, parents need to be aware of, that their child might have COVID?
Yeah, so the good news in children is that the symptoms are much milder compared to adults. They will still develop a fever. Kids can still also get the loss of taste and smell, but it can be very confusing, as I said, because they could be asymptomatic and have a mild illness which is just brushed off as a simple upper respiratory tract. However, in the context of COVID, if there has been potential exposure, please test again so that one could limit the infection. There are incidences, very, very rare in South Africa, where they can get quite a serious illness after what looked like COVID, a multi-systemic illness where kids can get very, very sick. Fortunately, it is extremely rare. So what we do see, mild illness, very few hospitalizations for COVID, and certainly very few deaths for COVID. But I think kids can still spread it, so it is important to diagnose it and make sure that the kids are isolated.
All right. Thank you so much, Dr. Martin McKay, for answering all of those questions for us. And thank you to all the guests that participated in the discussion that we had today here on Vital Signs, speaking about eye health as well as eye care as we wrap things up with this Eye Care Awareness Month. And of course, it's still a pandemic, so make sure that you go out and protect yourself. It's been great being with you. We'll see you again next week.